Hi, my name is Hunter Bailey and I'm a nursing student here at the USA College of Nursing. Here's my ID badge, and today I'm going to be doing the medication injection checkoff. If you can go ahead and scan the room for me. Okay, so the very first step that I'm going to do is I'm going to verify the physician's order and compare it to that of the MAR. Okay, so there's an order for heparin, 5,000 units subcutaneously every 12 hours. And on the MAR, there's an order for heparin, 5,000 units subcutaneously every 12 hours. Now I'm going to verify the 5 rights. The right patient is Jaguar J. Jones. The medical record number is 417-6352. The right drug is heparin. The right dosage is 5,000 units. The right route is subcutaneously, and the right time is every 12 hours. Now I'm going to verify any allergies. It says that he is allergic to penicillin. Allergies, penicillin. So now I'm going to perform hand hygiene, wash my hands, and select the correct drug. So selecting the correct drug, I'm going to select heparin. And the expiration date is December 5th, 2020, so it's good to go. Now I'm going to verify this to the MAR. The drug is heparin, and I have heparin. The order is for 5,000 units, and since I have 10,000 units per milliliter, I'm going to have to calculate this. So this means that I would be giving half a milliliter, and I'm going to give this subcutaneously every 12 hours to Mr. Jaguar J. Jones. What I want to do now is I want to go ahead and get my alcohol pad, my TB syringe, because it's a subcutaneous injection, and my blunt tip cannula. Okay, get my alcohol pad and cleanse the top of the vial in a circular motion and dispose of this in the trash below me. Okay, so now what I'm going to do is I'm going to get my TB syringe. Okay, so I'm going to open the syringe, and by maintaining sterility, I'm going to grasp it, and I'm going to remove the needle. Okay, I'm going to place it back in the package. Now what I'm going to do is I'm going to get my blunt tip cannula. I'm going to open it. I'm going to connect the two. Okay, I can set this down. I'm going to take this off. Okay, I can go ahead and sit this down. And I can move this to the side. And since I will be giving half a milliliter, I'm going to go ahead and draw up in air half a milliliter. Okay, you can see that this is half a milliliter. So what I'm going to do now is I'm going to inject this into the heparin. I'm going to inject the air. I'm going to turn it over. And I'm going to draw back more than half a milliliter so I can expel of any air bubbles. Okay, so to get rid of the air bubbles, instead of flicking it, I'm going to use my pen. Okay, and they're working their way up to the top. Okay. Piece of the plastic was starting to come off. Okay. So now that the air bubbles are gone, I'm going to make sure that I have the correct dose, which is half a milliliter. I'm going to turn it over. and remove. Okay, now what I'm going to do is I'm going to scoop the blunt tip cannula, and I want to show that I have exactly half a milliliter. Okay, so what I'm going to do now is I am going to take this off and dispose of this in the sharps container. Now I'm going to take my needle and connect. Okay. So now that I have drawn up the medication, I want to look at the medication vial again, and I drew up heparin, and the order is for heparin, 5,000 units. This is 10,000 units per milliliter, so I would give half a milliliter, and I have half a milliliter. And now I'm going to give this subcutaneously every 12 hours, subcutaneously every 12 hours, okay? And what I would do now is I would verify with another nurse. I would get him or her to make sure that I drew up the correct medicine and the correct dosing and make sure that my calculations are correct. So what I'm going to do now is I'm going to verify the 5 rights again. So with my medicine. Okay, so the right drug is heparin, and I have heparin. The right dose is 5,000 units, I have 5,000 units. I'm going to give this subcutaneously, which is the right route, and subcutaneously, the right times every 12 hours, and it is time to give the medication, and the right patient is Jaguar J. Jones. So now what I'm going to do is I'm going to set my medication down on the table. I'm going to move my trash over. I'm going to get my tape. And I'm going to prepare a label that has the patient's name on it and the drug and the dosage. So I'm going to write Jaguar J. Jones, heparin, 5,000 units, and I'm giving 0.5 milliliters. Okay, so now I'm going to pick up my syringe. I'm going to place this right here. So it's out of my way. Now that I have it, I am going to take an alcohol pad with me and my MAR, and I'm going to proceed to the patient's room. Okay, so knock knock, come in the patient's room. Okay, I'm going to set my supplies down on the counter, and I'm going to perform hand hygiene. And now I'm going to verify my patient using 2 patient identifiers. So Jaguar J. Jones, medical record number is 4176352. Medical record number is 4176352. I'm going to go ahead and assess for any allergies. So it says on the MAR that he's allergic to penicillin, and he has an armband that says penicillin. Mr. Jones, I note that you're allergic to penicillin. Can you tell me about what kind of reaction that you have? Okay, the drug that I'm giving you is not penicillin, it's heparin, so everything should be good to go. Now I would perform any pre-administration assessments for any specific medications if indicated. So now what I'm going to do is I'm going to verify the 5 rights again now that I'm in the patient's room. This will be my 3rd check for the 5 rights. So the correct patient is Jaguar J. Jones. The right medical record number is 4176352. The right drug is heparin. I have heparin. The right dosage is 5,000 units, and I have 5,000 units. I'm going to be giving this subcutaneously every 12 hours. So that's the right route and the right time, and now is the right time. So now what I'm going to do, sit this down, and I'm going to explain the procedure to the patient. Mr. Jones, today I'm going to be giving you your heparin shot, okay? And I'm going to be giving it in your abdomen. Do you have any questions? No? Okay, good. So now what I'm going to do is I am going to raise the bed up and I'm going to lower the side rail. Okay, so now what I'm going to do, after I do that, I'm going to don my clean gloves and my goggles. Okay, so now what I'm going to do is I want to go ahead and assess for comfort, and I'm going to go ahead and move his gown over his stomach because I'm going to be giving it in the abdomen. So now what I want to do is I want to find the correct injection site. So I'm going to be giving his subcutaneous injection in his abdomen. I'm going to make sure to stay away, at least 2 inches away from the umbilicus. I'm not going to go above the costal margin. Yeah, the costal margin. I'm not going to go below the pubic area, and I'm not going to go past the anterior superior iliac spine. Okay. So now what I'm going to do is I'm going to assess for skin integrity and see if there's any bruising, and the skin looks good to go. So now what I'm going to do is I'm going to take my alcohol pad, okay, dispose of it in the trash. Okay, and I'm going to go ahead and clean the site of injection in a circular motion. Okay, dispose of it in the trash. So now what I'm going to do is I'm going to take my medication, and I'm going to uncap it. I'm going to sit this down. Mr. Jones, I'm about to give you your heparin shot, okay? You're just gonna feel a little pinch. So I'm going to go ahead and spread the skin and inject at a 90-degree angle. Little pinch. Okay, gonna aspirate for blood return. I do not see any blood return. I'm gonna inject the medicine slowly. Okay, now I'm going to take it out and apply gentle pressure. And I'm going to scoop, because we never recap. I'm going to place this in the sharps. Now I'm going to assess for comfort. Are you okay? Are you comfortable? Is everything good? Good. So now I'm going to assess for any allergic reactions that the patient could be having, and he is not having any allergic reactions. So now what I'm going to do is I'm going to raise the side rail up. And then what I do is I'm going to take off my gloves. After I take off my gloves, I'm going to immediately perform hand hygiene. And I can go ahead, take my goggles off. Okay, so now what I'm going to do, since I just took off my gloves and I performed hand hygiene, took off my goggles, what I'm going to do is I'm going to get my pen and I'm going to document on the MAR and provide the correct documentation and the patient's response if indicated. And the right documentation is the 6th right. So now what I'm going to do is I would come back into the patient's room shortly, and I would make sure that everything's good to go and he's not having any allergic reactions, any adverse reactions to the medicine at all, and make sure that everything is okay. And this concludes my medication injection video. Thank you.